And hello and welcome. Thank you, Dr. Brewster, for joining me. Today I have Dr. Wendy Brewster, and she's the sister of Dr. Abena Brewster. Um, you guys have the sibling medical thing going on in your family.
Thank
But
you.
yeah. So Dr. Wendy Brewster is a medical doctor, and she went to medical school at UCLA in Los Angeles. She did her residency in OBGYN at Harvard UCLA. She did a fellowship in GYN oncology at UC Irvine. And are you involved with research where you are now?
I am in my role. One of my roles here is as director for the Center for Women's Health Research at UNC Chapel Hill.
Okay. And what type of patients do you usually see in your practice?
My practice is filled with a lot of amazing women. The women I take care of are those who have gynecologic cancer. So those are cancers of the ovaries, fallopian tubes, uterus, cervix, vulva, vagina, the lady parts, as I'll say.
Mhm.
And then also I do some complex gynecology and some of the more complicated gynecologic surgeries.
Okay.
And for my women with gynecologic cancers, I provide care in a spectrum from a time diagnosis, surgery, chemotherapy, through surveillance, and
Mhm.
on towards cure.
Mhm. So you're located in North Carolina. Are people there heeding the advice of public health officials there?
Largely, yes, they're taking it seriously. You know, the streets are empty. The supermarket I go to only allows a certain number of people in at the time, which I think is really responsible. And they give wipes. More recently, people have started wearing masks on the street. My neighborhood is quiet, except for people walking their dogs. The dogs are getting a lot of walks right now.
I know that's a way for people to get out.
Yeah.
Yeah. So the reason why I'm doing these interviews is because I wanted to put out a message for people of color or melanated people so that they could understand, how people are behaving in different parts of the country, how they can survive the virus, how and what they can do to avoid getting sick. So, what is your recommendation for people of color who are also cancer patients with compromised immune systems to avoid the virus?
So I think the recommendations that we've been hearing everywhere from the CDC, from Dr. Fauci, those are all recommendations that should be taken very seriously and followed as given. You know, my concern for people of color is that there's a higher incidence of hypertension, and we know that patients with hypertension, if they do get COVID, there are some other specific medical concerns we have to think about, and that may make the course of the disease a little bit more challenging than if they didn't. And so I think all people should follow the advice, but people of color shouldn't feel that this is something that they shouldn't pay attention to because they may be at increased risk.
Should these types of patients get symptoms of the virus and test positive, then what should they do?
So the recommendations that stand, I know, are followed differently in different communities, and a lot of that has to do with resources and how resources are managed. But you said tested positive. They
Mhm.
need to follow the advice that they're given at the time from the physician diagnosing them. You know, if they're sent home and they feel as if they're not getting better, they're more short of breath, they're having higher fevers, they need to circle back around to their primary care practitioner and let them know, or present back to the emergency room, just so that we're sure that the person has enough support throughout the course of this illness. You know, and if they're sent home, then you know, go home, rest, isolate yourself from other unaffected people, and try to get through this as best as you can, but reach out for help if you don't think you're doing well, or if somebody tells you they don't think you're doing well, because sometimes when we're sick we don't often make the best decisions. So I would say if you're ill and somebody who loves you, cares about you, observes that you're not doing as well as you perceive you're doing, you might want to take that consideration seriously.
Yeah, I noticed on TV they're showing a lot of the drama of the severe cases, which is it's a percentage of people that get sick, but most people feel sick and are able to handle it at home, I would say.
Thankfully, would you just to think about how much worse this would be if even more people got ill and had to be hospitalized.
True.
But just because you're sent home doesn't mean that everything's good. You still have to weather through it. And if you're not weathering through it, no shame, come back out. It's not just the older people who are likely it's not just the older people who can need hospitalization. There are a lot of people being hospitalized, a lot of younger people. And so you're
Yeah.
not invincible. One of the things about being young is there's a sense that you can weather everything. And I think what allows physicians to go and work is that there's some sense of invincibility, I think, that we have. We wash our hands, we wear our masks, but if it's a tougher road, you got to get help. You got to get help. And the patients who are immunocompromised, there's a lot being done in the cancer sphere in that scenario. We actually, at this time, in this COVID time, think more carefully about the regimens that people are on, the
Mm,
doses of the chemotherapy drugs they're getting,
mm,
or not, right now is the right time for you to have surgery. And so if your physician thinks that, maybe we should give a little bit more chemotherapy until we can have surgery at a time when it's safer for you, those are things that we need to take seriously. I, as a physician, as an oncologist, really think a lot more about what happens to my patients if their white counts get too low, because before COVID, it got low, we called them, they protected themselves, we had medications. And if they had a fever, we could bring them in the hospital and treat them. But now to have an immunocompromised person in the hospital, you're going to be ruling them out for COVID. You really don't want them in the emergency room. You really don't want them in scenarios where they'll be around COVID patients. And it's going to take a little bit of time to figure out whether that fever they have is just from their chemotherapy or whether it's related to COVID.
mm, mhm.
So there are precautions in place. And if your physician just seems a little bit more cautious, it's just for this time. We just all need to get through this period of time as safely as we can.
Mhm, mhm. And I've noticed too that many people are running out and buying a lot of supplements, and many patients that are on other medications may not know that there could be interactions, and especially patients that are on chemotherapy. And often, the doctors that are taking care of them don't know that they're taking supplements. So, regarding your patients, how do you advise them with this in mind, with the
So,
supplements?
so I know that a large percentage of my patients take supplements, not just because I ask them, but just because there's data out there that says that people do that.
Mhm.
And I think if you're taking supplements, you need to let your doctor know. Honestly, a lot of times I don't know what the supplements they're taking, what effect it's going to have. But we have these rather advanced systems now. We can enter that. And if there is some interaction that we know about, we can certainly advise or caution. I mean, we know that there's some supplements that shouldn't be taken if we're considering surgery. And those I think we understand a little better. With chemotherapy, the theoretical concern is that some of these supplements might limit the efficacy of the drugs that people are getting now. And we as MDs for the most part aren't trained in the science of supplements. And so for my patients who are taking supplements, I'll try and query why they're taking it, who advised them. If it's their neighbor next door, probably going to have a little bit of a lecture. Here at UNC, we're fortunate in that there's a center that can help provide some guidance. Or if there's somebody qualified to do that, I'll do that. But that said, even though I say that, I know there's a lot of that going on, and it's coming from
Yeah.
where people want to be sure that they're doing everything they can.
Yeah.
Yeah, it's a difficult one,
It
Uh,
is. It is. I mean, that's the supplements and nutraceuticals are one of my areas of expertise. But I often, especially when people have cancer and they're being treated, um, I often try to get in touch with the doctor that they're treating with just to make sure that the doctor knows, that they're taking supplements. And I think it's reassuring if they know there's an expert that's working with the patient. But often you guys don't know. And sometimes they are taking supplements that are going against what's being done with the chemotherapy, which is
you know, and I sometimes will tell my patients if it's something I have not heard of, that
Mhm.
can we just wait until we get past this Western medicine phase? And then, after I'm finished with your chemo, you can do all of that,
Mhm.
hopefully with some guidance.
Mhm.
And I have to say, that's not something that I don't ever promise them I know what they're taking if it has effect.
I think the key is getting guidance. And I know in most of the large metropolitan areas, and especially where the big university affiliated hospitals are in the United States, they are bringing on or they have on board integrative or functional medicine specialists that are able to help those patients. However,
It's a dynamic world,
yes, yes,
Yeah,
yes.
yeah.
So, but I know that with this COVID-19, that a lot of people have been buying supplements online and they're cleaning out the stores like Whole Foods and vitamin shops.
What are the supplements that people should be taking?
So we're talking about that in this series, and I interviewed Dr. Sue Fairchild. So if people go to that talk, she's talking about that. But she and I came up with just kind of like a few that are inexpensive and have few side effects. So vitamin C is one of them. N-acetylcysteine is one of them,
Mhm.
and zinc is one of them.
Yeah, okay,
Mhm.
okay.
So those
And
are
I'm a
usually,
big vitamin C and zinc, so I'm good and glad
yes, yes, yes.
I
Those
don't, yeah,
are
okay.
common ones that are inexpensive and easy. Well, vitamin C is not easy to access right now, but
Oh, that's so,
you
okay.
have to get in on a waiting line usually to get vitamin C right now. So, mhm.
That's good to know. That's good to know. I always feel when I say that they're expecting something more exotic,
They
when I say
probably are.
vitamin C. Yeah, they kind of want, well, don't you have something? My grandmother can recommend that.
But we're also telling people to do common sense things that people want to skip over, like getting enough rest, enough
Mm.
hydration, and eating plenty of fruits and vegetables. Which a lot of people are ordering out food. They're going to McDonald's and Burger King, and we really don't want to do that right now when we want our immune systems to work as well as they can. So.
Good to know. From
Mhm.
the authority, right? Now I can tell my patients I had a conversation with a specialist, and now they'll listen.
So I really appreciate you joining me today. Thank you so
Absolutely.
much. Yeah.
Thanks for the great advice that you give and the need, the need that you're addressing.
Oh, well, thank you. Thank you. Thank you.